But in summary, what we find, whether it's here in the US or across the world, is that patients with chronic pain often are not understood. So just like I had trouble understanding, many healthcare providers have trouble understanding their patients with chronic pain. Patients who have limited access often report this disjointed care, and they have to keep repeating their story over and over again, which gets really frustrating. They get frustrated by, the lack of evidence. So the imaging evidence doesn't back up their story. And so then they're less likely to be believed. So their journey is often really difficult. And it is a journey from this injury to the progression of chronic pain to this loss of identity to, what could go on to really almost medicalized poverty because they're not able to return to work unless they have a really good encounter with the healthcare system. And then that path can transform into something really positive. So the vulnerable population has many, many difficulties first accessing healthcare and then being within that healthcare system. From the patient's or from the provider's perspective, right? We are more transactional. So we'll see them just for this point in time, even though their journey continues. And often there's that same level of frustration that I was experiencing because I didn't understand what they were telling me. The frustration with kind of the bureaucracy of some of the insurance paperwork that they have to do. But what we also see is a lot of implicit biases. So healthcare providers tend to have this negative perceptions, negative biases, particularly at the intersection for minorities. So minorities, racial and ethnic, education levels, and gender. So those three things tend to be the things that draw out the most negative implicit biases from healthcare providers, whether they're making pharmaceutical decisions or recommendations for referral on to like a multidisciplinary pain clinic. And so that really does then do a disservice to the patients who are most likely to develop chronic pain, which would be women and minorities and immigrants and those that have attained less education, right? And so we've kind of got this intersection where the most vulnerable are going to be like some that are most likely to receive implicitly biased care during these conversations. And so trying to figure out how we're going to navigate that was where the papers then went on from there.